Sometimes a patient must go out of network. Can you get insurance coverage for it? This is part 1 of 2. Welcome, I'm Martine Brousse, your medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So today, let's go over the first 3 good reasons why you may have to go out of network and what to do about it. But let's start with out of network. What does it mean? Well, it means that the medical provider or the facility used is not contracted with your insurance or your plan. It means the provider will not be accepting the insurance allowance as payment in full. It means you will not be getting a discount and the fee will not be adjusted down. It means also that your provider will likely not be receiving payment from your insurance, or if so, a lot less. And down the line, it means you will pay more. Yes, it's unfair, especially if you have no other choice. Emergency conditions, for example, and that covers ER at the hospital, urgent care, ER doctors, any lab test, imaging done while you are in the ER, any specialist who treats you while in the ER or right after that, for example, for an emergency surgery, and of course the ambulance. But no other choice also means that you may have gone to an in-network facility, but some of the providers there have no contract with your plan. Could be, again, a surgeon, a radiologist, pathologist, any kind of therapy specialist, or the anesthesiologist. You may not have hired them directly, not even seen them face to face, and you may not even know about them until you get a bill down the line. But if any kind of service was rented to you in person or long distance, well, there might be a bill coming your way. A second reason why you may have to go out of network is called access to care, and especially if you have slow or no access to care. Now, federal mandates have requirements as to how quickly a patient needs to get to a specialist, to a hospital, or to a doctor. And if you look at the terms of your policy, your insurance will also have a section called Access to Care Standards or Requirements. But at times, you must consult with an out-of-network provider or use an out-of-network facility if you cannot get to an in-network one in time or within reasonable delay. Continuation of care is the third reason why you may go out of network, for 2 reasons. Either your current provider has canceled their contract with your plan, or you switched to a different insurance or a different plan in January, and this provider no longer participates. However, if you must continue an ongoing treatment, for example, chemotherapy, or if switching to a different provider at this time could prove detrimental to your health, then going out of network may be your only solution. So can you get in-network coverage for out-of-network services? The answer is yes. Well, let's just say maybe. So if you have no choice and it's an emergency, the Federal No Surprise Act will protect you. Any emergency service rendered by an out-of-network provider must be paid by your insurance at the in-network rate, and that provider must accept that rate as payment in full, even with no contract. Now, for certain other circumstances, for example, non-emergency services at an in-network facility, but rendered by an out-of-network provider, like an anesthesiologist, for example, you are also covered by the No Surprise Act. And last, air transport, air ambulance is also covered under the No Surprise Act. What to do if you get a bill? Call your insurance first. Let them know that these were emergency services. Let them know that the in-network hospital status should cover any out-of-network services rendered there. If a phone call does not do it, you may need to file a written appeal with your insurance stating the same thing. And do file a grievance against the provider if that provider refuses to abide by the No Surprise Act. If you cannot receive or make an appointment for in-network care for non-emergency services, it may be a violation of the terms of your policy, but it could also be a violation of state law. California, for example, has a very specific rule. And again, it could be a violation of federal guidelines. Again, call your insurance company, file an appeal with that insurance if necessary, and even file a grievance with your state or at the federal level for any violation. As for continuation of care, this is something better handled by your doctor. The office will need to request what is called a continuation of care authorization, expedited if your next scheduled treatment is less than 2 weeks away. Evidence such as a current assessment report, current treatment plan, record of ongoing treatment, as well as any potential list of detriments to your health, if interrupted, will go a long way towards obtaining that authorization. Whenever possible, I would also include any letter of support from other treating physicians. These 3 reasons are the most common, but there are others which we will explore in a separate video. If you have a rare disease or complicated conditions, if the in-network provider is unacceptable, or if there's nobody in-network. I so thank you for watching. Your subscribe, likes, and comments do help this channel grow to reach out and empower more patients like you. Thank you.